27 million Americans depend on one company for Medicaid or marketplace health coverage. On August 17, 2026, a filing about that company set off automated cyber alarms across the industry. The company was Centene. The filing named a chief. It mentioned cyber attacks. It was not a hack. What was actually sitting in Centene's record was stranger than the headline that triggered this investigation. Here is the filing itself, dated August 17, 2026. 3 items on the cover page. Item 5.02, Item 7.01, Item 9.01. Executive transition. Guidance reaffirmed. Standard exhibits. Nowhere on that filing does Centene report Item 1.05, the item the SEC created specifically for material cybersecurity incidents. This 8K was never about a breach. So why did a cyber filings radar flag a filing about job titles? Think of it like a smoke detector that reacts to steam. The press release used the words Chief Financial Officer. Its safe harbor risk section, boilerplate every public company files, separately warned investors about, quote, cyber attacks or other data security incidents. Same document. 2 unrelated sentences. 1 automated system that cannot tell steam from smoke. Understand the scale of the company that got misread. Centene is the largest Medicaid and marketplace insurer in the United States, headquartered in St. Louis, run by CEO Sarah London. More than 25,800,000 people were covered as of mid-2026. Total company revenue, nearly $195 billion in 2025 alone. The actual news was straightforward. CFO Drew Asher, who grew the company from about $126 billion to nearly $195 billion in revenue, is retiring at year-end. His replacement, Christopher Nexapor, arrives from Lincoln National with a 7-figure salary, equity awards worth millions, and a multi-million-dollar signing grant. Real money. Zero cybersecurity content. Buried deeper in Centene's own paperwork is the sentence that actually matters here. In its 2025 annual report, Item 1C, the Cybersecurity Disclosure section states the company has not identified cybersecurity threats that have materially affected its business, results, or financial condition. A CSO and a Chief Security Program Officer oversee the program. The board's audit committee signs off. On paper, everything is fine. Here's the first turn. A CFO filing is not a breach filing. Fair enough. But that calm, boilerplate sentence about no material cyber impact does not exist in a vacuum. Centene has a history, and that history did not stay contained to a footnote. Rewind to January 2021. A file transfer product called Accellion FDA had 0-day flaws, vulnerabilities nobody had patched yet, because nobody knew they existed. A hacking group tracked as FY2025, later linked to the CLOP extortion operation, used those flaws to plant a web shell called do mode inside vulnerable servers. No ransomware, just quiet, surgical data theft through a vendor's file transfer box. Strip away the vendor name and the mechanism is simple. A 0-day opens the door. A web shell holds it open. The file transfer appliance becomes the tunnel, and whatever sits on the other end, in this case, HealthNet Insurance subsidiaries under the Centene umbrella, walks out the back. The access window ran from January 7th to January 25th, 2021, 18 days. Across 4 HealthNet entities, federal breach filings later totaled 1,317,040 patients. Names, birth dates, insurance ID numbers, diagnoses, and treatment details. Not a rumor. That count comes from filings made with federal health regulators. For the people behind that number, this was not an abstraction. A diagnosis is not just a data field. An insurance ID is not just a string of digits. It is the record a Medicaid enrollee did not choose to expose, sitting on a vendor's server they had never heard of, breached by a crew most of them will never hear about either. 4 years later, a second thread surfaced, a different failure, same corporate family. In February 2025, the Justice Department said HealthNet Federal Services and Centene agreed to pay over $11.25 million. The allegation: between 2015 and 2018, the company falsely certified its own cybersecurity compliance on a federal military health contract. TRICARE, patch management, vulnerability scanning, access controls, reported as solid when regulators say they were not. To be precise, those are allegations, not a court finding of guilt. HealthNet Federal Services settled without admitting wrongdoing, and a company spokesperson said no breach or loss of service member data occurred in that specific matter. The settlement resolved paperwork accuracy claims, not a confirmed hack of military health records. Second turn: 1,317,000 patients exposed through a vendor in 2021. Over $11.25 million paid over certification gaps in 2025. And still, today's Item 1C says no cyber threat has materially affected the business. At what point does a pattern become the material fact? Here is why that question has teeth. Since December 2023, the SEC has required public companies to disclose material cybersecurity incidents fast, inside a new Item 1.05, usually within 4 business days. It exists precisely so a real Centene breach could not hide inside a routine filing the way this radar mistakenly assumed one already had. Which brings the story back to how this episode started. An automated filings radar scanning for the words cyber, breach, and Form 8K pulled this document because a headline fragment read, quote, "Centene announces plan chief." It never finished reading. Financial. It stopped at chief. Third turn. Somewhere between a false alarm and a real disclosure sits the actual risk: 26 million members worth of Medicaid and health data, sitting behind governance language that has not been tested by a fresh Item 1.05 since the rule began. The absence of a filing is not proof of safety. It is simply the absence of a filing. Open questions remain on the record. Does a keyword-matching radar deserve trust with headlines this blunt? Does immateriality language age well against a million-plus patient vendor breach still inside the same 4 years of reporting? And when the new CFO takes the seat in January, does cybersecurity oversight even cross his desk? Or does it stay entirely with the security team, insulated from the balance sheet that pays for it? There is a lesson here for anyone who scrolls past a scary cyber headline. Read past the first sentence. Check which item number actually got filed. 5.02 is a resignation letter. 1.05 is a 5-alarm fire. Confusing the two turns real corporate accountability into noise and buries the stories, like Accellion, that actually deserve the alarm. For a company at Centene's scale, the corporate lesson is not subtle. Saying no cyber threat has materially affected us is a legal sentence, not a security guarantee. Concentration risk: one insurer, tens of millions of members, one vendor ecosystem, means the next real incident will not stay a footnote. It will be the headline this radar only imagined. For members and patients, the takeaway is simpler. If you are covered through a Medicaid or Marketplace plan, breach notices from insurance subsidiaries do arrive by mail, months after the fact. Read them. Freeze your credit if health data was involved. And remember, a calm annual filing does not mean your provider network has never been touched. This was never really a story about a chief financial officer. It was a story about how easily a headline fragment gets mistaken for a 5-alarm breach, and how a real one, Accellion, already happened and mostly got forgotten. Figures here come from SEC filings, Justice Department records, and healthcare reporting. Full links in the description. Corporate breach. Which corporate filing should we open next? Case closed until the next filing.